Hi, my name is Dr. Sarah Bjorkman and I am an OBGYN and fertility specialist. And I am also pregnant. We are going week by week through pregnancy while discussing some key topics that are important to the health of you and your baby.
And with the beginning of the new year and maybe a new resolution to be more active, it is a perfect time for us to dive into one of the most important things you can do for the health of you and your pregnancy, and that is exercise.
Yep. So this episode is going to hit the highlights of exercise in pregnancy and how to maximize the benefit to mom and baby while also not putting either at risk.
Yeah, and just in case it's your first time meeting us, I'm Kurt. I'm a board-certified pediatrician.
I'm Sarah. I'm a board-certified OBGYN.
And we are the Doctors Bjorkman. Welcome back. As we are going week by week through pregnancy and nearing the end of that first trimester, we want to let you know that that terrible nausea and first trimester fatigue that is such a big challenge for many during pregnancy should finally be starting to lighten up a bit.
For me and all of my pregnancies, I definitely got hit by that first trimester fatigue. But as it finally starts to fade, I want to encourage you to be more active and kind of counterintuitively. Sometimes even in that first trimester, a workout gives you some more energy and gets you helping to feel a little better. The most important take-home message from this episode is this. Physical activity in pregnancy is the number one best thing you can do to reduce the risk of pregnancy complications and also improve maternal physical and mental health. I know that is a big statement, but it is 100% true. Like I tell my patients, if I could prescribe exercise to you during pregnancy, I would do that. We should no longer view exercise as like a pleasant behavior to engage in, but this is critical therapy to ensure better pregnancy outcomes.
Yeah. Now, we actually started out on Instagram way back in 2015 as Doctors and Dumbbells, as a longtime passion of ours has been fitness, while also working to encourage others to live just more active lifestyles. Again, it is one of the most important things any of us can do for our health and wellness. But it seems like there's still a lot of uncertainty in the community sometimes about exercising when pregnant.
100%. There are lots of people who get uncomfortable when they see someone really pregnant at the gym lifting heavy. One of my favorite power lifters is Meg Squats. And again, people sometimes lose their minds when they see people lifting heavy. There's like viral clips of women, this gal running a 6-minute mile when she's 9 months pregnant. But know that these women are doing something incredibly important to improve their health outcomes by staying active during pregnancy.
Yeah. Now we're going to use the next couple of minutes to highlight the key things you need to know to maximize the benefits of exercise while remaining safe for you and baby. I'm actually going to share some evidence-based recommendations for all of this, so stay tuned.
Before we go any further, let's discuss the short list of absolute contraindications or reasons you should not exercise while pregnant. And then aside from this list we're going to talk about, all women without a contraindication should be physically active throughout pregnancy, and that is a strong recommendation from ACOG that has moderate quality evidence behind it. As we work so hard to bring you actual data-based evidence, the recommendations we're going to share during this pregnancy are all strong recommendations from ACOG unless we state otherwise.
Yeah. Now, women with absolute contraindications may continue their usual activities of daily living, but they should not participate in more strenuous activities. Now, other women who maybe have relative contraindications should sit down with their OB provider to discuss the advantages or disadvantages of doing this moderate to vigorous intensity physical activity.
And because I know you are wondering, I want to let you know that physical activity during pregnancy is not associated with miscarriage, stillbirth, neonatal death, preterm birth, preterm rupture of membranes, neonatal hypoglycemia, low birth weight, birth defects, induction of labor, or birth complications. So if you don't have one of those contraindications we showed in that list, don't let the fear of these things keep you from exercising.
Absolutely. And now here are 5 key recommendations about exercise in pregnancy.
Number 1, Get at least 150 minutes of moderate intensity physical activity each week. This is the amount of exercise shown to achieve clinically meaningful health benefits and reduction in pregnancy complications. It might seem like a lot at the beginning, but that is the goal you're trying to work up to each week.
Yep, and you can know you're hitting that moderate intensity mark a couple of different ways. Either you can follow your heart rate and target some pregnancy-specific heart rate zones, or by using the simple talk test. So this, as it implies, means that you can feel your heart rate up, maybe you're a little shorter breath, but you should still be able to carry on a conversation during the physical activity. If you can't carry on a conversation, think about reducing the intensity.
Recommendation number 2, exercise at least 3 days a week. However, being active every day is encouraged.
Number 3, ideally you're able to mix both aerobic and resistance training activities to achieve greater health benefits. The findings of systematic reviews in studying this have demonstrated that combining both aerobic and resistance training during pregnancy is more effective at improving outcomes than interventions that look at just doing aerobic exercise alone.
Yeah, so not just cardio, add some weights.
Yeah, and there can also be some benefit from doing some stretching or yoga as well.
Number 4, pelvic floor muscle training, pelvic floor physical therapy may be performed on a daily basis to reduce the risk of urinary incontinence. Some studies shows that this prenatal pelvic floor muscle therapy is associated with a 50% reduction in prenatal and a 35% reduction in postnatal urinary incontinence. This recommendation came from some weaker evidence in the literature, and the important thing here is that instruction on the proper technique for those pelvic floor exercises is recommended to obtain optimal benefits.
Okay. And finally, number 5, pregnant women who experience lightheadedness, nausea, or feel unwell when they exercise flat on their back should modify the position to avoid that laying flat on your back position.
Yes.
Generally, you should listen to your body and make adjustments as needed.
Yes, definitely. That is because the thought there is as your uterus grows, when you lay on your back, it compresses the big blood vessels that run up your spine, the vena cava. And so sometimes that decreased blood flow makes women not feel well. However, again, listen to your body. The blanket statement, you should never lay on your back when pregnant or you should never do supine exercises, is not correct.
Just to remind you, this effort to be more active in pregnancy is associated with amazing benefits. Some of the first and foremost of this is fewer complications for baby, i.e. not having a large for gestational baby.
And there are so many maternal health benefits as well. So there's a decreased risk of pre-eclampsia, a decreased risk of gestational hypertension, gestational diabetes. There is a lower risk of C-section or needing an instrumental delivery. There's a lower risk of urinary incontinence and pelvic pain. There's a less risk of excessive weight gain during pregnancy. And it also helps with weight loss after delivery.
Yep, and this list keeps going.
Yeah.
Following the guidelines that we've linked here have been shown to improve blood sugar, decrease total weight gain during pregnancy, decrease risk of depression, decrease severity of depressive symptoms as well.
Yeah. Now, if you are pregnant and not currently getting the recommended 150 minutes of moderate intensity exercise each week, that's okay. Start now. A progressive adjustment towards that goal is recommended.
Yeah. And if you've been previously active, you can continue physical activity throughout pregnancy.
Yep.
So if you've been running 5 miles a day or lifting weights or going to spin class, that's great. Keep it up.
But do keep in mind that you may need to modify physical activity as your pregnancy progresses. There may be periods when following these guidelines is not possible due to fatigue or discomforts of pregnancy. And so women are encouraged to do what you can and then return to those recommendations when you're able. So people ask me all the time, what can I do? What exercises are okay? How do you do this? And so I just say, if you're new to exercise, start out slowly and gradually and increase your activity. Begin with as little as 5 minutes a day, and then add 5 minutes each week until you can stay active for 30 minutes a day. importantly, your body is going to go through many changes during pregnancy that are important to keep in mind when choosing exercises.
Yeah, so things like this is your joints and ligaments naturally become more relaxed throughout pregnancy.
Yeah.
And so it's a good idea to avoid some really excessively jerky, bouncy, or high impact motions that could increase your risk of being hurt.
And remember, your balance is going to change, so keep this in mind as it places stress on joints and muscles, especially in your pelvis and lower back. Because you're less stable and more likely to lose your balance, you're at greater risk of falling.
Yeah, and also the biggest thing about advancing your workout routine is just to listen to your body. While you're pregnant, your need for oxygen increases, and this may likely to affect your ability to do strenuous activity, especially if you're already overweight or obese.
So there are a few exercises you should avoid. These are things like contact sports or things that put you at risk of getting hit in the abdomen. So avoid ice hockey, boxing, maybe soccer or basketball. Skydiving would probably be a no-no. And anything that could result in a fall, such as downhill skiing, water skiing, surfing, off-road cycling, gymnastics, horseback riding. Again, there are things in here that I've had patients choose to do. They want to ride their horse. They understand the risk. This is something to talk about with your physician.
Yep. Other things to think about would be like hot yoga, hot Pilates, which could cause you to become overheated.
Yep.
Or things like scuba diving, or if you're doing special activities above 6,000 feet elevation, if you're not already living at altitude, that change to that somewhat hypoxic environment could be potentially challenging for you.
Yep. So whether you're a seasoned athlete or a beginner, watch for these things when you exercise. If you have any of them, stop and call your OB provider. So these are things like vaginal bleeding. You feel dizzy or like you're going to faint. You're short of breath before you start exercising, above the baseline, little bit of pregnancy shortness of breath. If you have chest pain, a headache, muscle weakness, if you start noticing calf pain or swelling, or if you start having regular painful contractions, you feel a fluid gush or leaking from your vagina, call your OB. All right, some tips for exercise in pregnancy. Make sure you're drinking plenty of water before, during, and after your pregnancy to make sure that you are hydrated. Signs that you aren't hydrated are you keep having this racing, pounding heart, your urine's really dark yellow.
Drink water, have your water around,
Yes,
stay hydrated.
Definitely.
Good nutrition is also really important to be able to have the energy to exercise.
Indeed. Wear a supportive sports bra to protect the girls, help you feel supported. Later in pregnancy, you may want to do like a belly support band to help. That may reduce some discomfort when you're walking or running.
Don't overheat.
I felt, especially in the first trimester, I just got really kind of woozy if I would overheat. I didn't like pulling my leggings up over my belly because I got way too warm. So when it's super hot, if you live in a super hot climate, if it's really hot outside, exercise in an air-conditioned environment, or like in the evenings if you're outside, because that extra heat can be a little bit overwhelming sometimes.
Yeah, I think another big thing, just getting over that barrier of going to the gym sometimes or being active is so important. So find a way to make it fun. If this is baby number 1 or baby number 3 or baby number 8, for us throughout each of it, it became date night. Whether it's hey, we have a babysitter so we can go to the gym and then go get a frozen yogurt or something after. Then just being active, and if you're a partner watching this too, realize the best thing you can do for your partner is to help them be well and healthy, is encouraging them to be active. And sometimes that means doing it with them. Sometimes it means removing some of their responsibilities so they have the freedom to go work out.
Totally. With my first pregnancy, I did not exercise enough. And deeply regretted it. There was 6 weeks in the weeks 30 of pregnancy where I was studying for a board exam and just did not move my body enough because I was sitting at a desk all day studying. And my body kind of fell apart because I wasn't keeping it strong. I had more low back pain. I had pubic symphysis dysfunction. I couldn't put a shoe on. It was rough.
Yeah, you were in pain walking.
Yeah. So in my second pregnancy, I made a very dedicated effort to stay strong during pregnancy. I used Meg squats +1 program. I also did some of the like OB stuff with that. It's a lovely, lovely program for weightlifting resistance training, as well as incorporating some like pelvic floor and deep diaphragmatic connective breaths and different things like that. So if you're looking for a program,
We can link that in the description notes below. Absolutely.
awesome. Yeah, truly, 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 if I could encourage you to do anything, it's to stay strong while you're pregnant. I think it's so funny that people get all worked up about exercise while pregnant, but if you see me hauling around my two 30-pound toddlers, nobody bats an eye. Like, you have to train for life. And so just start now, build up. You will only thank yourself. You'll have a better delivery, you will have a better pregnancy, you will have a better postpartum experience if you keep moving your body.
With all of that, prenatal physical activity is the #1 thing you can do to reduce your risk of pregnancy complications and improve both maternal physical and mental health.
Yes, you should shoot to get 150 minutes of moderate intensity exercise each week, and it's best when you exercise at least 3 times per week and incorporate resistance training as well as cardio.
Yeah, if you aren't already exercising, start now.
Yes.
It is never too late. Even a little bit is better than none at all.
Absolutely. So that's all we have for you this week. Please subscribe and stay tuned for the great pregnancy content we have coming ahead, and go enjoy your workout.
Bye, guys.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.